Okay, this video is called Low Fat, Low Sodium, Whole Food Vegan Awareness. And so the awareness came out of a viewer had sort of asked me about this. And like, what am I getting at here? If you look at something that is profitable, something that turns you into a patient, that gets lots of promotion. You know, the pink ribbon for breast cancer is the most famous one, but there's all kinds of popular screening studies, you know, for lung cancer, for all kinds of other things, all right? You know, health problems. And so anything that gets you into an office and turns you into a patient and somebody can make money off you, that will be popular and promoted and described as being this wonderful thing. Versus something like low fat, low sodium, whole food vegan diet, which is the most powerful promoter of health in the world, will never be promoted. And if that sounds contradictory, this lecture will sort of explain why and what's interesting about it. So imagine that you are like an internal medicine doctor and two 50-year-old fat guys walk into your office. Both of them have high cholesterol, so you get a pill for that. Both have high triglycerides, you pill for that. Both of them have elevated liver function tests. You send them for an ultrasound. They've got fatty liver. Fatty liver is so common, it's not even funny. Anytime you see elevated LFTs, liver function tests, you can bet almost always that patient has a fatty liver. Most of these diabetics as well. Okay, they both have elevated blood glucose level. You can get them at least one pill for that. Their hemoglobin A1C is high, an indicator of poor glucose control over time. They both have high blood pressure. Give them like 2 pills for that. They both have mild impotence. Give them a pill for that. Both of them have testosterone on the low side. Maybe a pill or a cream for that. We got 7 pills so far and counting. Lots of follow-up tests, checking for complications in progress. Thyroid function test might be a little low. In the future, might end up needing a pill for that. They both have relatively poor endurance. Consider sending them to the cardiac for a cardiac stress test. Maybe for, you know, a treadmill stress test. Dr. McDougall calls that a conveyor belt to the cardiac cath lab. Go to cardiac cath lab. Good chance to end up with a coronary artery stent. Maybe get recommended for CABG's coronary artery bypass graft. Consider adding antiplatelet medication, at least aspirin. There's at least 1 more pill, 8 pills so far. So every day the rest of his life, this guy is taking 8 pills and having to go for a lot of follow-up. So you're making money off him every single day the rest of his life. And he's not too healthy, so he'll probably die prematurely anyways. Alternative, you teach the patient about a low-fat, low-sodium, whole food vegan diet. He could potentially cure himself of all these problems. You don't make any money off him. There is no profit in this for big food. There's no profit in this for anyone. So it's never going to be promoted. So don't hold your breath. Go on the internet. You'll see, you know, these doctors that are, you know, stupid promoting carnivore diet, keto diet, Atkins diet, all this crap, nonsense, versus you look at somebody promoting low-fat vegan diet like myself, where there's no money in it, they'll have 1 million views, 1 million subscribers. That's okay. I'm not doing this for profit. I just want to make a good site. So that's the way the truth will come at you. It comes, you know, pared down. There's nothing to promote it whatsoever. I can't give you all these graphics of, you know, beautiful people doing interesting things. Okay, there's no money in this. All right, if a doctor suggests a vegan diet, what often happens, more often than not, the patient looks at him funny, as if the doctor's being weird, and patients will say stuff like, oh, you want to take away my ice cream? That's the only joy in my life, or I would rather die than stop eating meat, all this type of stuff. So this patient will get 8 prescriptions like we talked about above for pills. And the doctor doesn't really have time for this. He's got a waiting room full of patients. He knows he's going home late again. Most doctors are overworked. He doesn't get paid for talking about nutrition. It's not his fault the patient doesn't want a diet. So, you know, it's just the way it is. Education about nutrition is very time consuming and you don't get paid for it. Patient number 2 says, I'll try the low-fat vegan diet. So patient number 1, we just talked about, who declined the low-fat vegan diet, he goes and gets a coronary artery stent put into his heart. He gets recurrent chest pain. A year later, ends up going, or a couple years later, ends up going for a CABG, coronary bypass graft at 55. By the next year, he's got mild cognitive impairment. He's completely impotent now. His diabetes is getting worse. He has a small stroke. His cognitive function is declining a little more. This is a typical patient, by the way. Doctor, you know, his foot's swollen up. He's like, oh, what is that? Oh, crap, my diabetes is flaring up. Doctor says it's gangrene of the toes. Goes and gets his toes amputated on one foot. A couple months later, chest pain. He's got a myocardial infarction. His memory keeps getting worse. All these medical bills and poor cognitive function. He goes bankrupt, dead at 58 years of age. So that's a typical patient. All right. Now here's patient number 2. He goes low-fat vegan, cures himself of all his problems, keeps on working until 65, then he retires, enjoys his hobbies. He lives to about 85 years of age. Okay. There's no money in this. Okay. You'll be waiting for the cows to come home before this ever gets promoted. The corporation is not happy about it. It has to pay this guy a pension, which it does not want to pay. In addition, there's additional expenses for others, including SSN and Medicare. Bottom line is this guy's become an expense to society. The people that pay those bills don't want that. There's no money in this. So what I'm trying to say is this low-fat, low-sodium, whole food vegan awareness will never become widespread. It is only something that like more intelligent, more curious people can find by seeking out this information. So good for you. Hope this helps.